Hello, this is Dr. Jamie Skipper from Elevation Health Consulting here at the Digital Health Studio at CES 2020. I'm here with Bettina Experton, and she is from Humetrix. Thank you, Bettina, for joining me here on the stage. It's wonderful to have you.
Thank you, Jamie. It's a privilege to be here with you.
Well, it was a privilege for CES to have you as a panelist, and I know you were talking a lot about the regulations that are coming out this year, and that's my bailiwick as well. So let's talk about the regulations, and let's talk about your take on what the CES community really needs to be thinking about in terms of the regulations that are coming out this year.
So thank you, Jamie. Critical new rules about to be published, both by CMS and the ONC. So on CMS, this is a patient access and interoperability rule to basically oblige Medicare Advantage plan, health plan in the Medicaid programs and CHIP to have open API for patients to use and enroll in their plan to use their application of choice to access their data and compile their data with that application over their journey in healthcare. So that CMS, this is critically important, touching
Right.
Medicare and Medicaid beneficiary. And then on the ONC rule, which you know very well, this is trying to fix the lack of interoperability and delivering on the 21st Century Act,
Cures.
Cures Act, about information blocking.
Absolutely.
And so the rules now direct providers on the provider side in the same way to open their data with standardized API for, again, their patient to access with the application of choice, smartphone application, at no cost to them. I think this is a key, one of the key portion of the rule which tremendous impact on the CES community, because when we talk about consumerism, when we talk about AI, to make all of this work, the data have to flow in the hands of the patients who can then direct that data for data sharing and get more insights into that data. So those new rules are going to solve, I believe, the lack of interoperability, because in a common sense approach, the data will flow through the patients, directed by the patient under their own control.
So it's so exciting, and it's really going to be a big year for companies that are building digital tech solutions, especially any kind of solutions that are collecting, using, or analyzing any type of health data, or even beyond health data that's really important to the health story of the patient, right?
Yeah, absolutely. So whether we speak of wearables, sensor data collected on your smartwatch, for that patient not only to be monitored, but to be guided in his healthcare journey of his chronic condition, that sensor data has to be put in perspective with regard to their specific medical history, what medications they're on, they're not single but multiple chronic conditions they are suffering from. So those companies trying to guide patients with smart insight and their providers to better monitor those patients with a holistic view of their patient journey. That data coming from their EMR, multiple EMR from their multiple providers, or claim data turned into clinical data by application like the Humetrix iBlue button, for instance, are critical. So those new regs, I think, are changing everything.
So tell me about what Humetrix is doing in the next year to work with companies to get them up to par and getting them ready in this new regulatory landscape.
So Humetrix has been from the start. This is in our DNA to put critical information in the hands of patients for them to share them with their physician as they wish and they need to. So we have been accompanying those policies from the start. We have been a proponent of Blue Button from the start. We won 3 ONC Innovation Awards. I think what we can do, and we have an application called iBlue Button, which was the first CMS approved mobile application, truly native mobile application to access the Medicare Blue Button API. We are one of only 3 technologies who have been approved by the VA to access their new VA Health API, which is transformative. This is to serve 9 million veterans who now, under the Mission Act, can access care outside the VA. They need to better coordinate their care. They need to bring their own history and their data, to that non-VA providers, and that it can do that now with a smartphone using an Android device or an iPhone, thanks to technology like the iBlue Button app. But also we developed a iBlue Button cloud services. So for those provider systems, for those payers who have to abide by the new rules, open their data, we provide the tool with a privacy by design architecture, a platform for them to be able to access authorized data, consented data of their patients, and then aggregate that data with their existing application, making use of the technology we have developed for over 10 years.
Well, Bettina, what Humetrics is doing is really valuable, essential to the future of the CES community. Thank you for joining me here on the digital health stage, and thank you for sharing with the community about what you're doing.
And thank you, Jamie. I mean, your own personal journey from the ONC to where you are to guide the CES community, say it all. Thank you a lot.
Thank you. And again, this is Dr. Jamie Skipper from Elevation Health Consulting here at the Digital Health Studio at CES 2020.